So what we do once we decide that you have glaucoma, then we start off the treatment. So as I said earlier, most of glaucoma is without symptoms. We pick it up during a routine eye exam, and not one single test, like only the eye pressure is enough. We need many tests for us to say, is it glaucoma or not. So one may ask as to what is the age group in which you can have glaucoma. Usually glaucoma is more common as we get older. So it's a disease of the elderly. So when you get older, say past 45, 50, 60 and so on, the older you are, the risk of glaucoma increases. Younger people don't have that much of glaucoma. So we generally advise screening for glaucoma when you have say 35 to 40 years of age onwards. We advise a screening for glaucoma. So what this actually means is that, so the average human being, like any of, like even me for example, I am wearing glasses. So what we normally do is we go to an optician or an optical shop and get your power checked. We do not check the eye pressure. We do not check for glaucoma. So glaucoma remains missed, and you will be surprised to know that the many surveys that have been conducted in India and Asia and other parts of the world, most of the glaucoma remains undetected in about 80-90% or even more, unless you go to a qualified eye specialist who can actually screen for glaucoma. Glaucoma is missed, and simply changing your glasses, people believe that losing vision is due to common diseases like cataract and so on, so glaucoma is very often missed. So we advise that after 35-40 years of age, an adult must undergo a complete eye exam. It's called a comprehensive complete eye exam, not just changing glasses alone. Second is, when you, even if you don't have symptoms, if you have a family history of glaucoma, somebody in your family like father, mother, brothers, sisters, anybody in the relatives have glaucoma, your chance of developing glaucoma is high. It's an inherited disease. So therefore, a family history, suppose you have been playing badminton or shuttlecock during childhood, you had an injury on the eye. Any injury to the eye, any family history of glaucoma, if you are 35 years and older, and if you are getting older, and also if you have diabetes, let us say, you have medical illnesses like diabetes, and if you have been taking steroids for any reason, you take steroids for skin ointments, you take steroids for asthma, you take steroids for arthritis, you take steroids for any other medical condition, all steroids are known to cause glaucoma. So these are all the common risk factors for developing glaucoma. As you get older, you can also get glaucoma even without any of these risk factors. Therefore, get yourself screened for glaucoma when you are getting older, and 35 years and onwards, and you have this family history and so on. Once you are diagnosed to have glaucoma, there are various severity of the type of glaucoma which you have. Suppose you have a mild form of glaucoma, we usually start off with eye drops. Sometimes a laser is also done in the beginning to control the eye pressure. Suppose you have a narrow angle, we will do a laser procedure called a YAG laser iridotomy. So initially we can start off with the YAG laser for certain types of glaucomas. For the open angle type of glaucomas which are primary, we usually start off with one eye drop or sometimes two eye drops. So multiple eye drops are given. You have to use the drops regularly. It is not one bottle or two bottles. You must continue to use the drops for a long time, maybe even a lifetime, because this is a chronic therapy, and only when you are using the eye drops, the pressure remains under control. So treating glaucoma is drops. You can do injection studies for certain types of glaucoma. You can also consider glaucoma is very advanced. You have lost significant amount of vision. The pressure is not getting controlled with medication or eye drops. We consider glaucoma surgery also. Surgery is also available. Lot of new modern methods of glaucoma surgery is now available, and sometimes we even have what is called as a cataract which is present along with glaucoma. The average elderly person usually has some cataract and glaucoma also. We can combine a cataract and a glaucoma procedure together, and we can treat both at the same time. What you should not worry about is that once you are diagnosed to have glaucoma, once somebody is diagnosed to have glaucoma and is on treatment, generally you can maintain a normal lifestyle. You can continue to do what you are doing, you can continue with your occupation, you can continue to drive, you can continue with all other daily activities in your profession and so on. There is no need to panic. As long as in your treatment and the glaucoma is stable, you will continue to lead a relatively normal life. Then you don't have to worry. But if you miss out on treatment, you don't go for a checkup for 2-3 years, you miss the drops, you don't take the treatment advised and so on, you miss all those red herrings, then invariably you end up with a problem of glaucoma getting worse. And once your vision gets affected, the optic nerve gets damaged due to glaucoma, it is not reversible. That you must understand. It is not like any other disease like cataract or some other disease in which you can get back your vision. Glaucoma damage to the optic nerve is irreversible. You cannot get it back. So understand that it is silent, it is without symptoms, can occur in families. You must pick it up by having a routine complete eye checkup. There is treatment available, good treatment available, modern treatment available, laser treatment available. Do not miss your follow-up with the doctor. Keep track of your glaucoma and follow your medication advice without any fail. Thank you.